We are so grateful that you're here today joining us for our biannual virtual event, Coach's Wisdom for the ACP Paddler, sponsored by the United States Dragon Boat Federation Special Interest ACP Committee. Our committee is tasked with supporting the development of the all cancer paddler teams and the ACP division nationally. We're happy to open this event up to all cancer thrivers, whether you're part of an ACP or a BCP team, as every single one of us know what it's like to find your inner athlete through dragon boating after cancer. Before we get started, I want to go through a little bit of housekeeping. Remember, this meeting is being recorded, and we're going to have our wonderful speaker go through her presentation first, and then she's going to have an opportunity to teach all of you an at-home workout. That at-home workout requires 3 foot of space and a chair and a towel. If you'd like to participate, just turn your computer around or your phone or iPad so that you can see. You will not be on video during the workout. After the workout, there'll be a time for questions. If you hit the button on the bottom that says, at the bottom of your Zoom screen that says raise hand, I will call on you when we have an opportunity for questions. If you'd rather not have your name show up, as it does when you've raised your hand on the screen as this reaches a national audience, please feel free to put your question in the chat. And there is an opportunity for you to have that be anonymous. Your questions go out to just the host, myself and the panelists, and that way you can ask a question without it identifying you. And then finally, I want to let you know that we will be having some polls today. So if you can and want to participate, make sure that you have the capacity to answer polls on your computer or whatever format you're using for your Zoom. So thanks for getting all those housekeeping details out of the way. I want to introduce you to some of our fellow ACP committee member, Alice Turner, whose video is off at the moment. She is going to be helping me with the chat. So when the time comes to ask the questions, Alice, you will hear Alice's voice as she offers up some of your questions in the chat. And if you've raised your hand, I will let you speak for yourself when you ask your question. All right, time to get going. We are just so excited to be focusing today on how to help us get as fit as possible for the off season. So why don't we get started by assessing your readiness to get just a bit stronger. And we're going to do this through a poll. So go ahead and take a look at it on your screen. There's 2 questions, and go through and answer the first and the second question. The first question, if you can't read it, says, how motivated do you feel right now to get started on your off-season training? 0 being, where's the couch? And 5 being, start, I never stopped. So please let us know where you are on that scale. And there is no wrong answer here. We have had, all of us, a wonderful, busy season. And sometimes you need a little bit of a break before you jump right in again. The second question is, I have the resources I need to get stronger off the water. So let us know if you have the resources, or if you feel like just not yet. And hopefully you'll feel a little bit more prepared after today. I'm just going to give another few seconds I'm seeing a few more answers coming in. And I'm going to go ahead and end the poll and share the results with all of you. And it looks like a solid 53% are saying they are raring to go because they never stopped prepping. And that's great news, I'm sure, to our speaker, Donna Wilson. And then most of you, actually 100% of you who answered, there was only 7, said that yes, they had all the resources they needed to get stronger off the water. So that's wonderful. And I think now we're going to have Donna share her screen, and I will introduce you to her because we're really excited for to introduce her and her talk today, Motivation and Movement in the Off Season, as part of our Coach's Wisdom for the ACP Paddler series. So please welcome Donna Wilson. She has a remarkable 50+ years of experience as a registered nurse and personal trainer. Donna is a true authority in the field. She currently holds the role of clinical fitness specialist at Memorial Sloan Kettering Cancer Center and is the coach and founder of Empire Dragons New York. Donna's unwavering belief in the transformative power of exercise has made her a champion for cancer survivors. She firmly holds the view that integrating exercise into the after-treatment recovery process significantly enhances the quality of life for individuals. Her extensive expertise and heartfelt dedication to the well-being of cancer survivors makes her the ideal guide for our webinar today. So join us right now as we go through an exploration of motivation and movement with our leading expert by your side. And Donna, and please unmute yourself, and I pass it on to you.
All right. Can you hear me now? Great. Well, thank you very much, Erica. I really feel very pleased about this. I think the fact that I've been a nurse for so long and working with cancer patients, I only know that movement, exercise is the way to go. So I think just talking about this is great. And the fact that we can see so many people going and doing 53%, we're still moving, that's great. I think when you think about the dragon boating world and you think about your motivation for the 6 months that we're doing it, April to October, you know, you're really excited, you're active, you're probably exercising a few times a week, you're doing so much. And then you have the races and they're all exciting. And then, but now what you want to do is at the end of the season to say, okay, what can I improve? But how do you stay motivated to do it? I think if you're actively inspired and you have the inspiration from dragon boating, just continue that momentum. Once you're in motion, stay in motion. You know, I think if you stop, I think the problem is that if I look at the whole picture of cancer survivors, many of us are 40, 50, 60, 70. And many of us are more that 55 to 75. Unfortunately, there is an aging process of our body. And what happens is that in the 50s, we start losing about 1% of our muscle mass, even if you're really an active person. Then in the 60s and the 70s, you lose it faster. So here you're in great shape. You've got 6 months. You've been dragon boating. You've had a great season. And then boom, you stop. And you are being more sedentary. You're just doing other things in your life. You'll notice that you're going to get weaker. And the truth is the pain of not exercising becomes greater than the pain of doing it. So it's really important that we keep it that whole exercise and maintaining good exercise for all the large muscle groups. Remember that in dragon boating, legs are really important, the leg drive so you want good strength of the legs and the buttocks and your core. Now your core goes really from your shoulders to your hips. So all your back muscles and your core muscles are really a key factor. So just change it and maintain it, but stay the same. Don't let yourself get weaker. And for heaven's sakes, don't sit down. I mean, well, obviously, but don't make it a habit of sitting down for numerous times and then to get up and say, oh, exercise, I can't do it. Maybe you don't want to call it exercise. Maybe you want to call it something different. All right. So again, movement, exercise, dragon boating. We talked about April till October. It's the best time of my year. And now the off season comes and you say, well, what am I going to do? I don't belong to a gym, you know, or I live, you know, far away or I don't know what I should do. First of all, you want to think about what things you need to work on to improve your body with your stroke as a dragon boater. That's number one. So you want whether you need to work on lower body more or core. So become creative about it, but also make it a ritual, make it a habit, make it that you get up and you do it every day. And everybody's different when they exercise. Some people are very much morning people, some are afternoon, some are evening. It doesn't matter when, it matters that you're consistent. So I always like to think about 10 minutes first thing in the morning. It wakes me up, it gets me going. And in fact, we'll do a very simple workout later just to get your heart rate up and get you moving. So, and monitor your changes in your movement. So maybe do a training log, maybe have a book where you really write down everything. And if you work hard, you get a gold. Well, we'll give you one for the off season. The thing is, the benefits of exercises in the off season, this is just a slide. It really pertains to everyone, as well as all cancer survivors. The key is there is numerous papers and many research projects that have literally illustrated that people have a better quality of life and decrease the symptoms of cancer treatment with exercise. And it's the consistency. So by you improving your aerobic fitness, you're training your heart effect, which is very, very important in dragon boating. Muscular strength and endurance. You need those muscles to be strong. When you have a strong core, it also will help with balance and strength. Flexibility and stretching is very important. That will only improve your mobility. Body composition. Some of us have to lose weight, some of us have to gain weight. Get it under control. It also will give you a better quality of life. So it decreases all those kind of more psychosocial things of anxiety, stress, but fatigue has been well documented that it decreases fatigue. It decreases inflammation. It keeps your weight under control, and it can boost your immune system. Let's get this next slide up. So how do we start? Where do you start? You think to yourself, what am I going to do? First, pick things you like to do. Identify what you want to do. Do you want to do some fitness? So you want to do some weight training. You want to do a lot of body work, body exercises using your own body weight. Look, think about it. You can get more large muscle groups by doing push-ups, squats, lunges, and some core work. That's almost all the large muscle groups. Yoga is extremely important for that flexibility and stretching because we need to do it for lengthening in that stroke. Tai Chi is great for balance and straight, and dance for flexibility. So you start 5-10 minutes, and then you work up to 30-minute full workout. And you might go longer, you might go less, but try it for a 2-week challenge. So be creative. And then there's one exercise that I do with everyone, and it doesn't matter how old you are or who you are. 12 chair squats illustrates that if you can do 12 chair squats in 30 seconds, it shows that you have pretty reasonable leg strength. So it's very important. So then you might say, okay, well, I can do 12 in 30 seconds. So can you do 16? Can you do 20? But good form, not plopping down in the chair. If you plop down, it just shows that you don't have control going down and that much have muscle weakness. So that it's a great, simple exercise to do. The goal is that we want all cancer survivors and all people to do at least 150 minutes of exercise per week. And that has been well documented. And if you need motivation with music, put music on you like. I always find that, I can move better when the music is appropriate for me. So everybody likes a beat. So, do what you want to do. Put the work on, schedule it, make it a habit, as I said earlier, and a ritual. As we're going to do this few little things, we're not going to use equipment because, we're just going to do some home exercises, body weight exercises. And I'll show you with a dish towel how you can do some isometrics, which are really quite effective. It really starts with your internal desire to get better. That is the most important thing. And the thing is, I think dragon boating is a 12-month year sport. It is, you can't do nothing all winter and then get in the boat in April and expect to be great. It's just not. It's very physical. So if you think about some of the exercises that you want to do, you can think about cardio. Well, do you jog? Well, it might not, but if you maybe walk and jog, or just do some fast walking or race walking. Stair climbing is extremely good. If you have an old-fashioned Reebok step, go up and down the step. You could do, 50 to 100 steps and then monitor yourself. We'll talk about how you monitor yourself in a minute. Dancing, knee lifts, jumping, burpees. Nobody likes them, but they're really effective and they work. They're very good from a cardio and total body workout. Rowing erg, monitor your time, your distance, and your exertion so that you can see in your training log how much better that you're getting. Your core. Well, we have to do the Russian twist because we get those obliques going side to side. Plank, you can't complain. Plank is an amazing exercise for the whole body and the core and strengthening. Dead bug is a great exercise if you're not one that you can get on the floor and do a regular crunch and you have problems with your neck or head. So you do dead bug and it's just arms and legs back and forth, but not for 15 seconds. You have to do it for a minute or 2 minutes, or the same with walk the ceiling. Put your legs up in the air, the sole of your foot is on the ceiling, and you walk the ceiling. Again, for not just 30 seconds, you might want to start, but at least a minute to a minute and a half. Resistance exercises can be isometrics, like using a towel. You can use elastic bands, and there's all levels of elastic bands, from being very easy to being very hard, and weights. And then you can incorporate a little isometric at the same time with the weights. Body weight exercises, wall squats are great. You get down on the wall, your feet are about 12 to 18 inches away from the wall. Your knees are over your ankles. You want to have that nice right angle, and the weight is in your heels. So you lift your ribs up, you put your shoulders back, and you tuck your tummy in, and you sit there. Now, I have to brag, but I have someone on my team who's one of our older women who can do a chair a wall sit for 12 minutes. And when you ask her how she did it, she said, it's just, you do a little bit more each day, and it's consistency. So it really got, her quads are amazingly strong. Plank, another one. Sumo squats, lunges, step-ups. And step-ups, think about it. You know, some people say, well, I have bad knees. Step-ups are really good for strengthening the knees. Push-ups, you can do push-ups, start from the wall. You can go off a countertop, and then you could go off the seat of a chair, and then maybe get to the floor, start with on your knees, and then get to your feet. And calf raises. Flexibility and stretching is a must. And you really, if you have a really good workout, you might want to do a few of those before you start, and then you should do it at least 3 times a week. It enhances the range of motion. When you think of your shoulders and your hips, you move them out, in, up, down, circular, half circles, external rotation, internal rotation, and you need to keep them as flexible as you can. Also, that flexibility and stretching, you know, you have connective tissue over all your muscles. And sometimes when you say, oh, I'm going to try to get my arm up, and it doesn't go, and then you do a lot of releasing of this connective tissue, you can get it more pliable and flexible. And it strengthens muscles so you can, and in a balanced way. So lengthening and strengthening is key, and it improves by improving flexibility and stretching. Think about it. You have much more mobility. All right, well, how do you assess all these things? I mean, I think just so you know, I've been a lung nurse for most of my life, and I would tell you that I am on YouTube. And if you just go to YouTube and put my name in lung exercise, it comes up, but it goes a lot about like deep, little breathing exercises. But again, the key is look about if you know that you have to breathe out with every effort, with every time you're paddling and getting that paddle into the water, as well as all your workouts, everything you do. If you push something, you pull something, you over the head, or you bend over, you do it on the exhalation part of the phase of breathing. So when you're breathing, and I'm sitting here now, my breathing is normal. Now, after we work out, or if we're doing something, or think about you as at the end of a race, you could be 10. You're 10, you're 9, 10, you can't talk. But the key there is, how long does it take you to recover? That is the most important. That's why cardio health and aerobic is really, really important. And really, to that, when you're in a race, that you don't have to worry that when you feel that breathlessness coming up at 9 and 10 and you still have 100 meters to go and that the end of the race, you know, at the end of the race, 30 seconds, a minute, you'll be fine because you've trained yourself appropriately. Leg strength, that's why the wall sit is so good. Try to wall strength and try to do it for 2 minutes. Balancing is a key factor. Balancing is very important in general for all of us as we age, but really you should start on learning how to balance on one leg at a time. So start maybe 15 seconds on one, 50, and you want to make sure that your chest is up, your shoulders are down, and you're really putting yourself in good body alignment and focus. And just look forward and focus and see if you can, your goal is to be able to do 1 minute. Now, the other thing to look at, there's lots of scales. The perceived exertion scale goes 1 to 19, but you know, over the years, I think a lot of us have gone back to just use 1 to 10 because it's just easier. And then I would say 1, you feel fine, you're perfect. And maybe at 10 or 9 or 10, you're just bone tired. You are just exhausted. But how long does it take you to feel okay? And that's the key, is monitoring how long it takes you to recover. You know, there's a very simple test called it's a YMC step test. It's a 3-minute step test. And what you do is with a metronome on, you go up and down your 12-inch step, and it's about 72 times. And at the end of that, it's 3 minutes or so. You sit down on the step, and in 1 month later, you check someone's heart rate and you see where they're at. And there's a very good, well-researched chart to look at. So you can see if it goes according to age and what your heart rate is. So it really gives you a good sense of how physically fit you are. But examples of like jogging up a hill or doing your rowing erg or stair climbing is again all cardiovascular, and evaluate your level of breathlessness and evaluate your level of fatigue. All right, so we're going to get started. We're going to stand up and do some work. And each of these exercises that we're going to do them for 30 seconds. So it's not going to take more than about 10 minutes. But the first thing I wanted to show you with the towel, it never can tell me that you can't exercise, even if you're traveling, because wherever you are, you can always find a towel. So what happens is I'm using this, never been able to rip one, by the way, but I'm just have my trusty towel here. And it is, and I'm going to I'll turn the slides off in a minute. But what I want you to do is I want you to take the towel and I just want you to pull it apart as hard as you can. And it's at your chin level. Your elbows are in alignment with your shoulders and you're pulling it apart. You keep pulling, and hold it for 5, 4, 3, 2, 1, and release. So what you've done is that when you're pulling apart, you're maintaining that muscle in that contraction. And it really does work to really strengthen. So we're going to use that as we get up and do things. All right. So I'm going to stop the share. I'm going to stop it. So I'm right here so you can see me. Let me just open up the screen. And here I am. All right. I'm going to move my chairs over to the side. I always like chairs that don't have arms on it, so you can't push off of it. But the most important thing is you're going to start, and what you're going to do is you're just going to go all the way up. You have your towel, and what you want to do is some range of motion first for the shoulders. Just range of motion up and all the way down. And then what you want to do is go side to side. Now, when you're standing here, you're not standing with the legs hyperextended. Your knees are soft. And you can do a slight pelvic tilt, tummy is tight. And what you do is you just go over to one side, breathe in as you come up, breathe out as you go down. Breathe in as you come up, breathe out as you go down. And then you can take the towel right in front. Now try to keep your knees bent and your tummy tight and your butt squeezed. Get the obliques side to side. Really just use the upper body side to side. So let's go ahead and just do 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. I'm going to put the towel down for a moment. because what we're gonna do now is open up our hips before we exercise, okay? I'm gonna turn my clock around here just so I can really watch it so carefully. So my shoulders are down, and think about this, when your shoulders go down, your ribs rise up, and then you're getting those lats engaged, which we use a lot in dragon boating. So I'm gonna put my hands down, and I'm gonna bring my knee all the way up and around, all the way up and around. Get those hips going, up and around, good, up and around. We're just doing just a few of these, and it's up and around, 4 more, 4. Try to get your knee up as high as you can and point your toe if you can. Up and around and up and around. All right, now I'm going to put my little trusty stopwatch here. And what it does, it starts, and for every 30 seconds, I will be changing the exercise. They're all ones you know. It's nothing simple and it's easy. Okay, well, first we're going to just either walk fast or jog. Okay, so let's just 30 seconds. Just getting that heart rate up so your heart rate can nourish everything in your body. All right, just keep going. Just keep going. So simple, so easy, but so effective. And you're not going anywhere. You don't have to go outside. You can stay right where you are. All right, we're almost there. And make sure you're breathing out. Breathe out. Breathe out. All right, we have 5 seconds left here. 2, 1. All right, I'm not going to stop much. I want about 3 inches between your feet. Okay, and we're going to squat. I'll turn sideways because you don't want to squat like this. You want to push your pelvis way back. And here we go. All right, push the pelvis way back. So we can do this by going down and seeing you like you're skiing. Arms are out, then arms up to the shoulders. Down and breathe out as you come up. Down and breathe out. 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 Time for one more. Down and breathe out. Good. All right, now we're going to have our arms up. We're going to get that core activated. And let's get your knees up to your chest. Here we go. Breathe out as you bring the knees up. Keep going. Come on. Don't give up. Keep going. 4, 3, 2, 1. All right, great. All right, now we're going to do the crossover. Arms up, right elbow to left knee. Arms up, and here we go. We're going to alternate. Keep going. Keep going. Then push back that other shoulder. All right. Nice work, everybody. All right, just put your legs out, put your arms in front, go side to side. Lift up your opposite heel. Feel like your torso is moving nicely. Good. Just a few more seconds, then we'll start. The next one, you're going to have your legs out, knees bent. You're going to take your left arm up, make a fist, put your right arm out, and here we go. Side crunch. 30 seconds on the right, 30 seconds on the left. And just breathe out. Good, you're doing fabulous. Good, nice. A few more seconds here. Keep the arm up. Now, if you wanted to make this harder, have weights in your hand. Put a weight in your top arm and a weight in your hand. And stop. Let's take the right arm up, left arm out to the side, and over. And over. Over. 3, 4, 5, 7. Keep going. Keep going. Keep going. Good. You're all right. Weights are on up. And stop. Good. Nice work. All right, I'm going to pick up the towel now. And we're going to just do a few isometrics with the towel. First, we're going to just do a front raise. So your hands are in alignment. And you know what? We could do a squat with this. Why not? So we're strong. Down, up, and come up to the shoulders. Pull. Really pull the towel apart as best you can. Because then you activate all those muscles. Down and up. Down and up. So think, well, is it the lats that you really want to get stronger for your dragon boating? Is it your thighs? Is it your butt? Is it your core? So every time I come up, I squeeze my butt cheeks and tuck my tummy in. Every time. Now I'm going to come up here. Knees are bent. Pull as hard as you can. Pull, pull. 5, 4, 3, 2, 1. Now the towel's not very long, but we're going to put it up, and it's a slight V. And when we come down, we're going to push our shoulder blades down and get those lats engaged, and back up. And we're on now. Down and back up. Down and back up. You could do with each of these exercises for a minute. Down and back up. Down and back up. Down. Really focus. Think about yourself. It's all about how you can make yourself stronger. And when you then participate in the boat, you're working really a team. You're all in great shape. But it does take 12 months a year to be the best you can. 2 more. Down, up, down, and hold. Good. Now, let's just get those biceps. Nice, easy one. Hands underneath, pull the towel apart, and let's go up on our toes then. 1. Good. You're doing fabulous. Nice work. Good. And down. Get those calves pumped. Up on your toes. On your toes. 2, 1. All right, now I'm going to put you out in that plie position. I want you to go side to side. Your heels are in alignment with your shoulders, toes out. Okay? Now we're going to have our hands over grip after we just go side to side. And anytime your shoulders are hurt, just go down and loosen them up with a little bit of a pendulum. That's all. Now, here we go. We're going to squat, reverse curl over the head, shoulder press, down, down, squat, up, and up. So combining things as much as you can to get the workout going. And again, if you have weights or a body bar or an elastic band, you can use it. I tend to use a lot of body bars, and I like them. Keep going. Up and down. We're going to do a few more here. Up and down. Up and down. All right. We moved the body pretty well. Now, what I want you to do, I'm going to do some balance. I'm going to stand on my left leg, bend my knee, tuck my tummy in, shoulders are down, and I'm going to put my hands out and I'm going to lift my leg up. Okay? Focus. Shoulders down. And down you go. That was just about 20 seconds. Just to get everything going. Other leg, bend. Don't stand with a hyperextended knee. Bend. Tailbone under, shoulders down, thumbs back to engage the back muscles. And let's lift that leg. you might find one is better than the other. It doesn't matter where you put your foot. Whatever you'd like, you could even do tree pose. Good. All right. Interlace those fingers, turn them inside out, and stretch that upper back. Now put your hands behind your back, interlace them, straighten them, and pump back. Bend your knees, hinge forward from your hips, and stretch. Hold 1, 2, 3, 4, 5. Come on back up, release your hands. 2 shoulder rolls, 1, 2. That's all we have time for, and we're done. All right, so let me come back to my slides. All right. Let's see here. All right, so we'll go to the next slide. And these are all the things that we just did. I had them up and they're right here if you want. The stretching, the hip opening, the jogging. Mountain climbers, just, up and down, we on the floor. Squats, crossover bicycle, jumping jacks, arm circles, which I didn't do, but you would understand why that's so incredibly important. And some more stretching. All right. Oops. Let's go back to this slide. I think above anything, you have to constant attention to yourself. I want you to reflect on your exercise sessions. What was hard? What was easy? How can I make it better? Feeling good about yourself is essential, and making positive progress. Instead of dwelling on mistakes, imperfections, look forward to the opportunity to try again. I think we're always striving to make our stroke better and to do better. Dragon boating is physical, technical, mental. It's very physical. It's using almost every muscle in your body, but to the strength you want them, the leg drive, the core. The arms don't do as much as the core and the legs. And it's always teaching about the skill of the stroke. We always need that from our coaches. But then the mental pieces we don't talk about as much, but by being physically stronger, now you start to think about really that mental focus. You need the mental focus for your races. You need to be really physically strong. That sometimes you don't want to sit in the boat when you're out there getting in the boat and you're going to the start line and you're thinking about, gee, well, what am I going to do after this race? You keep your head in the boat and you learn to really focus and stay mentally quiet for 10, 15 seconds, which is so really very important, and no talking in the boat. But it's really, these 3 things are the what we need to all work on. I mean, we as personal people, coaches, paddlers, all need to be more physical. And, if you have a physical problem, then coaches, we can always help you figure that out. And the technical we do in the boat, and again, or on the erg, you can keep practicing all winter on the erg, but stay mentally strong is really important. Well, I'm going to stop now and answer some questions for you. And thank you very much.
Thank you, Donna. That was absolutely excellent. And I am sure that people are thinking through their own activities that they do to stay fit and learn something from you today, and revising their own program for the off season. I want to take a moment right now to introduce Alice Turner as well, who I told you was going to be helping with the questions in the chat. So I'm going to push us on gallery view and allow me a second while I make sure that I've pinned the proper folks. And Alice, if you put your video on for us, that would be great. All right, so I am starting to see, I think Alice is still muted, and I'll get started for her. I am starting to see a lot of thank yous, and I echo that, Donna. Wonderful thank yous in the chat. And agreement with you that physical and mental are the keys to success. And I heard from a member who's asking what an erg is, and that is a really helpful bit of information to know. Some teams actually in the off season do use ergs for training, and others don't. So it would be useful, Donna, if you want to just go through what a rowing erg is or what a paddle erg is.
Right. Yeah. I mean, I think with the erg machine is a machine that literally will monitor your stroke. It is a machine that looks, there's two. The one, you have the Concept 2 rower, and then the erg machine is you actually are doing the stroke and going down, and it monitors, and you can really monitor how fast you're going, what your stroke rate is, and what your half stroke is. I mean, it really does. And you monitor that, keep it in your training log, and we keep going and going. Now, my team as well is after we had a space, and we practiced a lot, and the problem is COVID came, and now it's all a little difficult. Some of us have them in our home, but a lot of, I know people go and get the Concept 2, or there's a couple of other rowing machines that are available, but it is really good to do that because the rowing machine is really fantastic. And we, as coaches, monitor how well you're doing from that erg or rowing machine.
Thank you for that. I have a question in the Q&A from Pam. She asks you, Donna, how you feel about swimming versus rowing on the erg as a mechanism of getting fitter.
Swimming is flexibility. It's, you don't get as strong unless you do aerobics in the water. But I think swimming is great for flexibility, but it does not, the erg, it doesn't replace the erg or the rowing machine.
And I do see that other folks in the chat also have liked their erging machine. There's someone who loves her hydro. And there is a few thank yous as well. And then I see Alice got her video on, so she'll go back to taking on the chat. But I see thanking you, Donna, for your excellent presentation, and that you're an amazing coach, which I know a lot of your teammates echo. And then a few things about mental toughness, and maybe you can talk a little bit to that. Some folks saying that the staying mentally ready for exercising in the off season and being ready for the on the water season or the racing is the hardest part. And maybe you can talk a little bit about that.
We don't talk about it all that much, except on race day sometimes, when we want to be really focused. I think what you need to do is, as you exercise and you monitor yourself and you get stronger and you get say you're on I do a lot of biking. So if I'm on my bike and I'm going to go up another step, I'm going to make it a little harder. I'm going to make it a little stronger. I'm not thinking about anything else as to finish this program and do the best I can. And that's going to make me mentally stronger all the time because I'm using my whole body. And then when I get in the boat, I'm strong and I can feel like I can really focus. And I think you need to do, that's about a lot of self-empowerment. You really need to really think about what you desire to do. And I think pick something that is your weakest point on the boat. And that's what you focus on.
Donna, there's also a question about scar tissue in the chest from surgery and how best to exercise.
Well, I've dealt with this a lot. And so I would tell you that it depends if they've had radiation, and what it does is it really makes things tight. Now, flexibility, this whole thing with flexibility and stretching is key. So I do a lot of stretching. If they're very tight in the chest, get a half roller or a full roller and you lay on the roller. So you open up the pecs. The pec muscle here, whether you had implants or you just had surgery or a different lung surgery, what happens is they are such that they want to bring the shoulders forward. So you have to lift the ribs up and go back. I mean, if you look at a lot of people as we age, we sit like this. So what you need to do is always think lift ribs, or get a half roller if you're new, or a full roller. I have both, and you just lay out, but then put your palms up. When your palms are up, you're rotating your shoulder back, and stay there for 5 minutes, and it'll open the chest. But there's a lot of other exercises. There's a lot of flexibility. Like I do a lot of figure eights. So I think about every position, the shoulder will move. The shoulder, you go up and you go down, flexion and extension. You do lateral, and then, adduction and abduction. You do full circles. There's a very simple exercise too that looks at back and shoulders, but you do a lot of external rotation and then this internal rotation. So you need to keep everything that's attached into the shoulder, and the pec is here, and all your other muscles lower down and in the back, you need to keep them flexible. That's why mobility, flexibility, and stretching should be done every day. 5 minutes worth will make a big deal. I would tell you that I worked with a lot of women after breast cancer. And many years ago, I did a video that was out, and then what happened is that they'll come to my classes when I was working and had all these classes. And then they say, oh, I'm fine. And they go home and say, well, I'm fine. I'm doing all right. No, it's all over. And then they realize about 2 or 3 years later, they're going up to reach onto the top shelf, and their arm won't go any further than this because it's all tight. It's not going to stay there. We can come back and we get flexibility. After radiation, after surgery, you have to move a little bit every day. You can't just say, okay, I did it once and it's all going to be okay. This connective tissue gets really sticky. I think the best way I could explain connective tissue, if you took 5 layers of saran wrap and put them together, how frustrated you get when it goes over and you just rip it and throw it away. That's kind of like, I look, it's connective. Then you've got to keep kneading it and moving it. So it's really important. I mean, shoulders up. There's, stretching over the head and back and doing it nice, easy, flowing movements. That's what you have to do to maintain them.
It's excellent, Donna. I also would answer that for people who've had other cancers other than breast, if you've had surgeries or radiation, the types of things that Donna's describing are the same things that are going to affect you. Difficulties with flexibility, difficulties with sticky connective tissue, altered mechanics, and the exact same advice, which is keep moving and don't stop. That the flexibility is going to be key for you to be able to overcome some of the post-radiation, post-treatment changes. The only exception here is if you have a hernia. And I do want to just take this moment to remind people that none of the advice that we give today in the Q&A replaces your doctor or your primary care team's, your personal trainer, your physical therapist's advice. We're offering general information, and I'm grateful to answer your questions about general issues, but keep in mind that your own primary care team for your health is the best for answering those questions.
Absolutely.
And Alice, go ahead. I think you have a few more questions in the chat.
Yes, there's another question. What do you recommend is a good ratio of on the water practice versus land training hours per paddling per week?
Okay, well, if you want, the true standard is 150 minutes a week for sure. And that could be all year round. All year round. Just because you're in the water and you're paddling doesn't mean you stop exercising. I think paddling in the water is our sport and what we're doing, but it also is that you're home doing all your other exercises. And I think the truth is that if you look at the 150 minutes per week, you need to get in flexibility, you need to get in stretching, you need to get in strength training, and you need to do cardio. And I would say cardio sometimes is the weakest link on some people because of whether it was a surgical problem or it was that they just don't like it. I mean, a lot of people say, well, I don't like to run, or my knees hurt. There's lots of things around it. I mean, there's lots of ways of doing different things. And I think that that is the piece that you really want, because that's when you're at the end of that 500 and that your steerer in the back is screaming that you have another 75 meters and you're like, oh my God, I can't do it. I can't do it. You can do it because you're strong enough to do it and you're mentally strong. So that you can't just say, I just do a little bit. You have to push yourself. You always have to do a little bit more, just a little bit more. You know, like if, you know, running up hills is a really, a very good thing to do. And if you do it twice and you say, oh my God, I'm short of breath, I don't want to do anymore, do it again. Keep pushing yourself. Make yourself, get your body how you like your body. How does your body feel? You want to strengthen your body to be strong. So you're really going to make a difference in that boat.
Great, Donna.
Before-
Another question is, what about a good exercise for rotator cuff?
Well, you have to see what this is, you know, first of all, you have to know where the tear is. And that's really where I would say, like what Erica said, you really have to go to the physical therapist, or you have to go, is it external? Is it in the back? Is it up at the top of the shoulder? Is it down? Do you have a tendinosis? It's very difficult. I just had a friend who had a fall, and in fact, he's doing physical therapy and he's doing much better. So that you have to leave those kinds of things to the experts. And that's what's important there.
I do think, though, that something that all of us on the ACP committee agree with, and Donna is a champion as well, is injury prevention through the whole year is important. And the way that you prevent injuries in the boats during the racing season is making sure that you are flexible and strong all year long. So I know that there was a question also about injuries that can occur with weight training in the setting of folks who are after cancer. So any advice, Donna, about how to approach weight training?
I think the first thing is I would tell you, if you know anybody that's going through cancer treatment, they should be exercising all through cancer treatment. That's my honest opinion. And they have less fatigue and less problems. When they come, what I would say is start slow. You start with 2 pounds and you do, you know, you could do your front raises, your lateral raises over the head. You know, you might want to do a little bit of reverse fly. Do 10 reps and try to get through 2 sets. At the end of the 2 sets, and those 2 pounds are really super light for shoulders. Now I'm just talking shoulders. I'm talking raises, out lateral, over the head. I'm not talking about biceps and triceps. I'm really talking about the shoulder. I would do 10 reps, 10 repetitions of each exercise, 2 sets. When that's easy, then you go up to 3 pounds. When your bicep, because we use the biceps so much in everything we do, when we pick up anything, you probably can go a little heavier. So when you're doing a bicep curl, you might be able to go to 3 or 4. And again, the whole key is can you do 10 reps, 2 to 3 sets, and then you go up slowly.
Donna, do you have any suggestions particularly for lower abdominal strengthening?
Yes. Yes. Well, yeah, there's a lot. I mean, a lot of people feel that they're lower. One of the easiest things you could do, and I can show you right here, is a very simple, easy investment, is a Pilates ring. Okay. So a Pilates ring, first, you can just take it and put it between your inner thighs, sit up tall, and when you squeeze in, not only are you doing adductors and your lower abdomen, you're doing your lower abdomen. So when I squeeze in, I can feel my lower abdomen tightening. Now, another exercise is you got on the floor, you put it between your lower leg and you lift it up and you lift it down on the floor. There's lots of things that you could do, but whether you walk the ceiling where you're flat on the back and you're walking the ceiling, you do that long enough, it incorporates all the abdominal muscles. And that's where dead bug is good, because it goes back and forth with your legs. And a lot of people have a lot of problems because when they do a crunch on the floor, they're using their head like a turtle, you know. But what they need to learn is that keep their head straight and think breathe out with the stomach and tummy in. So the stomach is pulling you up, not your shoulders and your neck. And if you can't do it, it just says that your abs are weak. You could do abs literally every day, to be honest with you. You could do them every day. And that's what's hard. And, or just on the floor, I could do it here, but you know, if you're sitting on the floor and your leg is back, it's a reverse curl. So reverse curl gets that lower abdomen. You can even leave your legs up and then stretch out one leg and put it down, then stretch out the other leg and put it down. The chair, it's a little harder. Actually, it's easier on the floor, but you know, there's lots and lots of exercises for that, a lot. But again, your breathing pattern has a lot to do with it. You don't bear down, hold your breath and do the exercise, because what you'll do is bear down, push the diaphragm down and expand your stomach. And you'll really stretch the stomach out, instead of when you're doing like just that reverse curl, when you're coming up with those legs, you're breathing out, tucking the tummy in, so the lower back isn't doing the work, the core is. So there's technique is really key factor.
That's wonderful, Donna. And I'm just noticing that we are up at 5 minutes of before the hour. So I'm going to stop the questions for now and say a huge thank you to Donna Wilson for a fantastically informative talk. And I think a big take home message for all of us is that dragon boating is the physical, the mental, and the technique. And bringing your mental game allows you to stay focused on staying fitter and focus on your technique throughout the year. And there's a lot that we can all do to just be a little bit more fit than we were the day before, right? So we don't need to be suddenly super people. We just need to be a little bit fitter than we were previously. So I want to just launch a poll real quick to get a sense of where you guys are at now. And see if you can answer these two questions. We'd like to know what motivates you to get stronger in the off season, and just type in a brief answer. And then also how ready you are now to build even more strength and endurance. 0 is nope, and 5 is bring it on. So go ahead and fill it in, and we'll give you a little bit of time while we say our thanks. I also wanted to just make sure that you all know that Donna is on the ACP committee, as myself and the chair. Alice Turner is also on the ACP committee, and we have on the attendees a number of the ACP committee members as well. Oops, I'm just seeing there's a raised hand by Julie Bryant, and while people are filling in, let me just allow her to ask her question real quick. Go ahead, Julie.
She's muted.
You can take yourself off mute.
Is that okay?
Yes, go ahead quickly.
Okay, I just wanted to note that one of the things that I've been trying to get across to our paddlers is that mindset that just because you're a cancer patient or a cancer survivor, that your life is not over and that you can return to 100% functionality and maybe even improve your life to what maybe it was better than it was before.
Yeah, I think, Julie, you're absolutely right. I think that the research shows it there. I mean, it's just very crystal clear. I personally think that when you get the diagnosis of cancer, I would hope that someday the physicians will give you a prescription and you'll start to exercising. All the people that when I was at Memorial Sloan Kettering, and I had lots of people going through treatment and came to me. If I compared them to, I see other people when I go to clinic, and they were so much weaker because these other people were physically fit. And it makes a big difference. You can fight it. Plus, it's better for your immune system, you know?
Absolutely.
So
I mean, we all know that exercise reduces your risk of recurrence by about 30%, depending on the cancer that you have. So not only does it make our quality of life better, but it also improves our chance of being recurrence free. So I'm going to go ahead and end the poll and share the results with all of you. And I would say that 75% are bring it on when it comes to ready to build more strength and endurance. And that is fantastic. I'm glad that you're here. And I look forward to reading through what motivates you to stay stronger in the off season. And we will publish that as part of our recording that will be available to you on our USDBF ACP website. And also we'll post it in the ACP BCP Cancer Facebook group. And I wanted to make sure that all of you know that if you have any questions about the All Cancer Paddler Division, about ACP team development, that the folks to find are us, and that you can find us on the USDBF website, and then just go to the ACP page, and all of the information you need, frequently asked questions, an infographic about team development, available ACP festivals, other teams in the area, and most importantly, our email so you can reach us is all on the website. So thanks again, everyone, for being here. And thank you, Donna, for a spectacular presentation. Thank you.
so much. All right.
All right. Take care now. Bye.